pillar that needs to be checked. And speaking to that conversation this morning is pharmacist Francisca Wenjike. Good morning, pharmacist. Good to have you.
Good morning. It's nice to be here again.
Yes. Whenever we see you, we are strong, we are agile because we're going to learn one or two about our health. Now we're looking at hypertension, high BP for short.
Yeah.
What exactly does it mean? When we say hypertension, what are we looking at? And what are the types of hypertension do we have?
Okay. So I'm sure that before now, a lot of us have heard high blood pressure, including the ones, people that like checking their blood pressure and the ones that don't like going to check their blood pressure. So basically, high blood pressure or hypertension simply means having your blood tension from the term higher than normal, and it has to be consistent over a period of time for it to be called hypertension. You cannot just walk into a pharmacy or a clinic and you check your blood pressure that first time and it's elevated and you call it hypertension. It has to be consistent. They check for a period of 3 times, 3 different consecutive days, not the same day, to diagnose you that you're hypertensive. So it simply means that your blood pressure is above normal. And the normal range of blood pressure, when we say it is normal, it is below 120 over 80 millimeters of mercury. That's the systolic is 120 and the diastolic is 80 millimeters of mercury. So if it is above this, that is when, for an extended period of time, that's when we start to be concerned that you might become hypertensive. So if your BP is below 120 over 80, it is normal. But when it goes above 120, let me say 120 to 129 over 80 millimeters of mercury, you are pre-hypertensive. So I don't know if that definition is clear enough. It just means above normal tension of your blood.
Yeah. Above normal tension of your blood.
Yes, above the normal pressure that your blood is supposed to flow through your blood vessels. That's what we term as hypertension.
Okay. So what age is usually affected? What age do you, when we say someone is suffering from high blood pressure, at what age would you say, yes, this person is? What age is safe and what age is at risk?
Okay, so I'd like to start by telling us the type that would,
yes.
then we'll dive into that. Everyone is at risk of hypertension, actually. Yes, everyone is at risk. So we have two broad types of hypertension. We have the primary or essential hypertension and then secondary hypertension. The most common one is the primary hypertension. That is the one that people, as we advance in age, we are predisposed to getting. So I'm sure that's the most common one you find when someone says I have high BP or BP. That's the one we refer to. So that one comes up due to, it could be stress. I mentioned age. It could be stress induced. It could be age, your lifestyle, the kind of food you eat. So people who eat very spicy food, spice may not be the normal spice, as little as salt. Eating too much of salt can predispose you to having hypertension. So while the older people are more predisposed to having it, is that as we age, the blood vessels are meant to be elastic. So as we age, the elasticity reduces. It could be due to deposition of fat or other things on the blood vessel. So as we age, it's likely that the pressure that the blood requires to flow through the vessels would increase because the elasticity is reducing. And so let me quickly dive into the secondary hypertension, even if we may still come back to the primary later on. The secondary,
That's to say we have two,
yes,
primary and secondary.
Yes, the secondary hypertension, that is the one that even children can have. It is born out of, let me say, it is secondary to other conditions, disease conditions in the body. Some children may have maybe issues with their kidneys, issues with their liver, or other organs of the body. So the hypertension can result from the stress caused by those other disease conditions. So that's why I said that anybody can have hypertension. It may not be due to age, it could be due to other factors, other disease conditions.
So you talked about children being at risk of having secondary hypertension.
Yes.
At what age are we looking at?
Okay, it could be any age.
It could be 2 years.
Yes, some children do not form properly. I'm sure you've heard of preterm babies.
Yeah.
And babies that are born with malformities. So it could be those children. It could be any age. It could be genetic. So we cannot say a particular age that secondary hypertension can occur.
Okay, but does this hypertension actually affect those children at that tender age, or it grows with them and start affecting them later when they are adults?
The thing is that they keep monitoring the children, they keep monitoring the child, because you cannot tell. They just manage the disease condition and try to manage other factors surrounding it, just so that it doesn't happen at all in the first place. Yeah.
Is hypertension a disease or a condition?
It's both.
It's both.
It's both disease and condition.
Is
because
it,
you don't.
Is it transmit? Can it be transferred to someone? Is it easily contagious?
Hypertension is not contagious. It's not transmissible. Only through only genetically. So if your family is known to be hypertensive, yes, if any of maybe your grandfather, your father, anybody in your family is known to be hypertensive or was hypertensive, you are more at risk of developing hypertension than someone who doesn't have a trace of hypertension in his or her family.
All right. So we have high blood pressure and we have low blood pressure. Which would you say is more dangerous, more risky?
Okay, I'm going to say that another time we should discuss that, but it will shock you to know that low blood pressure is more dangerous than high blood pressure. That's a discussion for another day. Just have that one.
Yes, So when we talk about hypertension now, what are the symptoms we are looking at?
Okay,
what should we look out for?
Another name for hypertension is silent killer. It's a silent killer. That's another name for hypertension. So most often it doesn't give signs, unless if you're very, very mindful of yourself, you're very, very observant. It could give you dull headaches, blurry vision, weakness. So you have to be very observant to detect these signs, because it doesn't give signs most of the time. You just have to keep checking yourself from time to time.
It doesn't give signs at all
most of the time, because the signs are very, very trivial, and you may just take paracetamol or take something and feel better, and you just wave it off without going to check your blood pressure, and it's still there.
Okay. But you talked about headache. Yeah.
Yes.
So when you have severe headache, like consistent headache, you should check out for high BP.
Yes, you should.
Okay. So how can we prevent high BP? How can someone prevent it?
Okay.
Maybe from reoccurring, or from even getting it at all in the first place?
Well, the people who have it in their family line may not be able to prevent it. Like I said, when I was talking about essential hypertension, that's the primary hypertension. It could be gotten through lifestyle, the kind of food you eat. So on your own, you can start by reducing your salt intake. That's the most common one. And then other spices, reduce your salt intake. Try to avoid sedentary lifestyle, that is sitting at a particular spot for a long time. Your offices, at home, laying down at one spot, that's very bad.
Sorry, I'm going to break you there. Are you saying drivers are at risk because they sit hours in a vehicle, driving from point A to point B?
They are. They have two or more predisposing factors. They are stressed, especially far distance drivers. The stress and then the sedentary lifestyle, they are very much at risk of coming down with hypertension.
When you say sedentary lifestyle, explain to layman, what do you mean?
That's the sitting on one spot. That's the
sitting on one spot is what she means
for a
by
long
sedentary.
time.
Okay.
Yes. So, what was I say? Okay.
Yes.
Dieting, eating properly, eat more vegetables, and avoid too oily stuff, fatty stuff. People who eat nkwobi and all too much. Yes.
Okay.
Yes, please. Red meat and all. Just try to eat healthy and exercise as much as you can. It mustn't be very serious exercise. Maybe walking, taking early morning walks, maybe every day you can schedule like 20 minutes to 10 minutes depending on your schedule every day and exercise. It could help to prevent you from coming down with hypertension.
Oh, okay. So does hypertension kill? If yes, and like high blood pressure, if it does kill, at what stage would you say, okay, this is beyond managing? The person just has few days or few years to live, just like in case of cancer, when someone goes get diagnosed and they tell the person, oh, it has spread, you have less than 6 months to live. Does it happen in the case of hypertension? If not well managed, does it kill?
Okay. Hypertension doesn't kill if you are conscious, if you watch it, if you are maintained properly. So if you're on your drugs as you should take it, and it keeps being reviewed from time to time as it should be, it is not expected that it will not kill, because you are maintaining it at a particular level. So I did not finish with the classification of hypertension.
Okay.
So from above 160 millimeters of mercury and over 100 millimeters of mercury, it is considered as hypertensive emergency, either hypertensive urgency or hypertensive emergency. Hypertensive urgency is that it's too high, like it's unsafe at that level, but there is no organ damage yet. But when there is an emergency, it means your organs are beginning to fail, like they are beginning to be affected by your elevated blood pressure. So it's at this stage that anything that wants to happen can happen at this point, like someone dying, coming up with a stroke, going down with a stroke, or any of those things. But you don't have to wait until it gets to that level, because it can be managed. It can be managed between 120 and 130. That's for people who are advanced in age. But as a young person, I don't see any reason why you should allow your blood pressure to get up to 130 before you do what you're supposed to do. So if all these measures that are put in place, that your lifestyle, and or if you follow them well, and even if you eventually come down with hypertension, you manage it properly, you're not going to die, you'll stay alive.
Okay.
Yeah, so it's not like cancer or HIV or any of those
Yeah, I was actually asking, at what point does it take a life? At what point does it kill the person?
At the stage where it starts to damage your organs, at that emergency stage, that's a hypertensive emergency when it gets to that stage. Aside people who, in their family, they are at risk of coming down with stroke. Like I said, everything is individual based. As much as these facts have been laid before us, yet everything still boils down to the individual. So your system is different from my system.
Okay,
Your family.
So it all depends on the person's system.
So you just have to check from time to time and live well, maintain a good lifestyle.
All right. I heard drinking water also helps reduce blood pressure. How true is that? Because while you were mentioning what we should do to prevent hypertension, talking about don't drink alcohol, the ukwabi part of it, you didn't talk about taking lots of water. So how true is that when it comes to hypertension?
Actually, while it's good to drink water, nobody's asking you to go and drown yourself. It will not prevent hypertension, please. Because drinking excess water too can cause a problem. It can damage the kidney because you'll be stressing the kidney to excrete the water. So water doesn't, if for anything, taking excess of water would increase the volume of fluid in your body, and that would increase the volume of fluid of blood running through your veins. And we don't want the blood vessels to become more stressed or increase the tension. So if for anything, it might even increase blood pressure. So just take moderate amount of water. You don't have to take so much. The only one we are concerned about is the alcohol, taking alcohol excessively. Your body needs alcohol, but it produces sufficient amount of alcohol that it needs to function. So taking in extra alcohol is you stressing your kidneys, stressing your liver, because the liver breaks down the alcohol and other chemicals that you take in. So taking alcohol is what we don't encourage. But water, just take little per time, just from time to time sips of water, not taking excess water. It doesn't help prevent or treat hypertension.
Okay. All right. So tell us in one word, how do we stay healthy and avoid hypertension, whether high BP or low BP? Just give us your advice. A few seconds.
Okay. My advice, that's what I've been saying since, live well, eat healthy. You know the healthy food now. Enough vegetables, enough fruits, stay off alcoholic drinks, as much as possible, stay off fried stuff. And then try to exercise from time to time. Make it, incorporate it or add it to your routine every day. Yeah, try to exercise from time to time. And then as much as you put all these things, you practice all these things, try also to get yourself checked from time to time. You can just walk into any pharmacy. They check blood pressure for free. So walk into any pharmacy when you pass by, check your blood pressure from time to time. Prevention is better than cure. It's better you catch it early than trying to.
Yeah, but if they can afford it, they can also have the gadgets, the
Yes.
equipment to check high blood pressure even in right from the comfort of their homes.
Yes.
And when you were talking about fried things, what about air fry? Is it still
Air fry.
yes?
Okay, we're trying to avoid the fat. So when you fry with granite oil or you fry with red oil, we just try to avoid all of that because it can cause clogs in your vessels, your blood vessels. Like I said, one of the causes of hypertension is the accumulated fats in your blood vessels. So we're trying to avoid that as much as possible. So any other thing is
I heard there's some soya kind of oil that is good for the body, like
Yes, there are.
what's it? This olive oil kind
olive
of.
oil. But yeah, as much as you're using the olive oil, try not to fry. Some people when they're frying their stew, you burn off everything and just go off with the
Okay.
residue of
Excess oil.
excess,
is
yes,
bad.
yes.
All right.
That everything should be done in moderation.
Nutrition. Okay, thank you so much, pharmacist Francisca, for throwing more light on hypertension. Like you said, we're going to visit low blood pressure because we really need to talk about that. Some persons actually suffer from it, and we need to know the symptoms so people will be able to differentiate between high blood pressure and low blood pressure.